The opinions and statements expressed in the following program do not necessarily reflect those of WWDB, its staff, or management.
Good day, everyone, and welcome again to another edition of Boomer Generation Radio. This is your host, Richard Address, coming to you from WWDB AM 860 here in the Delaware Valley and streaming live on WWDBAM.com. And again, a reminder that if you want to reach the program with some ideas, suggestions, etc., just email us at boomergenerationradio@gmail.com. That's boomergenerationradio@gmail.com. Welcome back again to Boomer Generation Radio on WWDB AM 860 and streaming live on Boomer Generation on WWDBAM.com. And again, the website to contact us is boomergenerationradio@gmail.com. And it is a pleasure to welcome you to the Kendal segment of Boomer Generation Radio. This portion of Boomer Generation Radio is brought to you by Kendal, a not-for-profit system of communities and services located in 8 states in the Northeast, Mid-Atlantic, and near Midwest regions of the United States. Kendal advocates for and empowers older adults to reach their full potential and is committed to working with others to together transform the experience of aging. To learn more about Kendal, which is Kendal, visit kendal.org, kendal.org, or call them toll-free at 888-759-0128. That's 888-759-0128. Mention that you heard about them on Boomer Generation Radio. And on our Kendal segment of Boomer Generation, we want to welcome Lori Flynn and Gretchen Cole. Ladies, are you there?
Yes, we are. Yes, we are.
Great. Lori Flynn is the Director of Nursing at the Kendal in Hanover, New Hampshire, and Gretchen Cole is the Assistant Living Administrator for Kendal in Hanover, New Hampshire. And we welcome you to Boomer Generation Radio here on the Kendal segment. And we wanted to begin a conversation, because this is not a conversation that's going to just take a half an hour. This is something that is becoming more and more and more present within baby boomer generation and dealing with ourselves and our parents. And that's this whole issue about Alzheimer's and dementia. And just to start this conversation and lay the foundation, could you define the difference between dementia and Alzheimer's?
Yes, this is Gretchen, and I'd be happy to start us off. Dementia can be defined as the loss of mental ability that's severe enough to interfere with normal activities of daily life. It can be defined as a group of symptoms that is caused by the general death of normal brain cells. And there are approximately 70 types of dementia, with Alzheimer's disease being the most common.
And so is that Alzheimer's is sort of like the most advanced form of dementia?
I wouldn't say most advanced, but it is the most common form of all of the dementias that are listed, meaning the majority of people have it.
Okay. So I have to jump in because this just broke on the news yesterday, and I made notes and somewhere have a newspaper report of this study that was released, I think, from a couple of universities. I think Georgetown was one of them, about this blood test, to determine 2 or 3 years ahead of time whether a person will develop Alzheimer's. Can you comment on that?
This is Gretchen again. I did read that article, and I think that it's a great step in the right direction. I think that, as the article pointed out, there still is more testing that needs to be done, but I think that it will certainly help with diagnosis, and will also probably relieve some fears that people have once they have that test done.
What do you mean, relieve the fears? Because I know there's a huge fear factor now.
Yes, there is. Well, I think that there's a general fear of people who maybe already have a relative with Alzheimer's disease. They wonder if they are going to get it. They can wonder for really a long time if they're going to develop it.
Is there a, just looking from your involvement on the ground floor? I mean, you're basically dealing with individuals and families every single day. How do you counsel a family when they come to you and or about to place someone in the facility that they know that they're on that slope? What can you walk us through some of the conversation and how you deal with that?
Yes, I can. We're very much an interdisciplinary team here. So there are a number of people who are involved in the process, including nursing, social work, and our clinic staff. So when we've had this type of communication with the family and begin those discussions, it's really centered in on the individual and how we can best meet their needs and help with that transition. Everybody goes through the disease process differently, so we have to look at everybody as individuals. Somebody who may really transition into the extra care that they need in this memory center, might totally differ from somebody else who really needs us to break it down into stages and steps and begin introducing them to the memory care center in a variety of different ways, just basically by visiting or asking them to volunteer. Mm-hmm. When they do become a resident of the memory care center, we still continue to assist them with the transition. We continue to offer support to their families, again, through that interdisciplinary team, and we really encourage families to support one another. They've already been through the transition. They can be a great support to somebody else.
Lori, you're the director of nursing at Kendal in Hanover, New Hampshire. Do the nurses that you're working with who are dealing with the memory unit and dealing with individuals who are working themselves through dementia and or Alzheimer's, do they require special training, or is there a special approach to this?
First of all, let me know what I should be addressing you as. Well, is it Rabbi?
No, just Richard is fine. That's
just
fine.
Richard?
Yeah, it's fine.
I think we will be getting to that question when we talk about when it comes time to choosing a community, and maybe we can continue on with some of the general information regarding dementia.
Well, let me approach it from a different perspective. I hear so many people, contemporaries of mine. We'll be having a conversation, and they'll all of a sudden they'll forget. They can't retrieve something right off the top of their head, and they'll say, "Oh, I'm having a senior moment," and then they'll have this flash of saying, "Oh my God, is this what's going to happen to me?" What could you just tell us a little bit about the difference with somebody having a so-called senior moment? They can't put their fingers on something, a fact right away. I mean, it comes maybe a minute later or 30 seconds later. That's not a definite indication that they're on this path of dementia, is it?
No. There is a scale, a 7-point scale that is used to summarize when an individual has cognitive impairment that are consistent with dementia. It's called the Global Deterioration Scale, or the Risberg Scale, and it's a scale when the first point on the scale, or number 1, is a person with no cognitive impairment. The second rung on that ladder is somebody that has those senior moments that are not consistent with cognitive impairment. It's not considered a problem with dementia or cognitive impairment until you get to the third scale of that, the third ladder on that scale, and that is considered mild cognitive impairment. And then 4 through 7 are consistent with dementia on that scale.
Is it true that everyone, as they age, the natural process of aging, there's going to be some cognitive decline? Is that a fact?
It is a fact that normal brain wear and tear you do get some cognitive decline. It may be just that word finding, name finding, just those kind of things that, you wake up in the middle of the night and then you realize what needed to surface to answer a question.
So, and there's also, because we have to compress a lot of this in a half an hour, there's also this studies, I see this a lot in magazines and sometimes on other media, that you can ward back, keep that tide of cognitive decline from really getting stronger by constantly, obviously, staying active, exercising, and doing brain, like crossword puzzles and that type of stuff. Is that a myth or is that actual fact?
That is actual fact. Diet, exercise, and brain fitness to the level of maybe learning a new language or really exercising your brain to its fullest.
You mentioned diet. Talk to me about that. How does diet impact brain function and decline?
Diet is important because you want a diet that is low in animal fats, high in vegetables and fruits, and you want to make sure that you have your omega-3 fat, oils, and that's pretty much it as far as diet.
So, in other words, for those of us down here in southern New Jersey and Philadelphia, less steak sandwiches.
Oh, yeah. No Philly cheesesteaks there.
Let's watch it. The Chamber of Commerce is going to, they know how to get you. I want to remind our audience, you're listening to Boomer Generation Radio here on WWDB AM 860 in Delaware Valley. And we're speaking with Gretchen Cole, the Assistant Living Director Administrator, at Kendal in Hanover, New Hampshire, with Lori Flynn, the Director of Nursing at Kendal in Hanover, New Hampshire. And this segment of Boomer Generation Radio, as a reminder, is brought to you by Kendal, a not-for-profit system of communities and services located in 8 states in the Northeast, Mid-Atlantic, and the near Midwest regions of the United States. And Kendal advocates for and empowers older adults to reach their full potential and is committed to working with others to together transform the experience of aging. And again, a reminder to learn more about Kendal, that's Kendal. We invite you to visit them at kendal.org or call them toll-free at 888-759-0128. That's 888-759-0128. Again, this is Boomer Generation Radio on WWDB AM 860 here in the Delaware Valley, streaming live on WWDBAM.com. And to contact us, just email us at boomergenerationradio@gmail.com. Lori, you mentioned before that idea of when people seek entrance into a facility, what those caregivers, they are going to come to you knowing that this is a major life transition that their family and their loved one is undertaking. What do they look for? How do they begin to handle that very, very difficult process?
Richard, I would like to give you some good news before we get to that segment of the talk this morning, and that is there are some conditions, medical conditions, that can present with memory loss or present as a cognitive decline, but are treatable. And oftentimes a depression or hormonal imbalances like thyroid hypothyroidism or Cushing's disease, or certain infections, a urinary tract infection or pneumonia, or deficiencies of vitamins, especially vitamin B12, can present as a person with cognitive deficits. And if identified and treated, those memory problems can resolve.
That's good to know. Thank you. That's very good to know. So walk me through then, before we start zipping out of time here, from your perspective, Lori, that caregiving concern.
I'll let Gretchen take the lead on this one.
So, Richard, just clarify for me again. You'd like to know what the role of the caregiver.
Right. And, that they're presenting, they're coming to you, they're dealing with a very, very traumatic moment in their life. How do you begin to, as the administrator of the assisted living program, how do you begin to deal with this, the caregiver approach?
Again, everybody is different and is individual, and it can vary. So, if a child has a different experience, in my opinion, than a spouse does when they are having their family member come into the memory care center. So we design an individualized plan for the family member, and that can be not only related to their health, but how they would transition, making sure that we know as much about their life history as we can. And this goes from where they went to school to simply how they drink their coffee in the morning, or even if they like coffee in the morning. So we do all of these things. We try to continue to keep the individual linked to the community so that they don't feel stigmatized or segregated in any way. And I do a lot of communicating with the families. I will either call or send an email within the first 24 hours and let a family know how the first night went, and encourage them that they can call the nursing staff at any time to get an update. And we do a lot of communicating within the first weeks or the first months, depending upon how a person transitions. And during that time, there's a lot of reassurance given that things really are okay, and the staff are trained to provide this type of care, and they really do a tremendous job in helping with the transition. So
communication, that's important for people. Does every Kendal facility have a memory care unit?
No.
So you have one in Hanover.
That's correct.
And off the top of your head, do you know which one of the other ones do?
There's about 3. The one that comes to mind is the Admiral in Chicago.
Okay. And again, not every, from my experience as well, not every assisted living facility has a memory care unit. Is that correct?
That's correct.
So it really is part of the research of a family to find the appropriate and qualified memory care units in their particular area.
Yes.
So one of the other, then that begs the question then, when a family, how does a family then know when it's time to make this move? It's a very, very traumatic moment. When do they know that they really have no choice but to place a loved one in a facility?
Richard, it's Lori Flynn.
Right.
And oftentimes we talked about that global deterioration scale.
Mm-hmm.
When the individual with cognitive impairment reaches about stage 5 or 6, that person is needing help with all activities of daily living, with finances, with transportation needs, and may be exhibiting some behaviors and may have some problems with incontinence. Usually when there's wandering, where caring for your loved one with cognitive impairment, and they are wandering and up night and day,
mm-hmm.
It really stresses the care person, the care provider. And if you add in maybe some resistance to care,
mm-hmm.
Maybe incontinence, then it really becomes a strain on the caregiver. At that point in time, it may be time to look for help in a community setting.
I've heard from families that I've dealt with, in a pastoral counseling sense, that occasionally somebody who really is exhibiting advanced signs of dementia or Alzheimer's can have a certain violence associated with some of that behavior. Is that true?
Yes, it is. And oftentimes it comes out of frustration because the behavior is a form of communication.
Ah.
And it's a matter of trying to figure out what that person is trying to communicate.
Do you mean the person who starts to act out this way in some primal level is aware that their ability to communicate is hampered, and this may be the only way that they can express an emotion?
What I would say more is that they're expressing a need, and it may be that there's pain. Maybe when I try to help you put on your clothes, maybe you have pain and you're unable to tell me that, and so you strike out at me. Or maybe you have you're wandering and trying to seek because you think you need to go home to prepare a meal for your children coming home from school. So there's communication with behavior, but the trick is trying to find out what that communication is. Yeah,
and for the caregiver, it's very. I mean, I've spoken to people in my clergy role as pastoral counselor that the caregivers themselves feel a combination of guilt and frustration that they can't understand this and it concerns them, and yet they don't know what to do sometimes.
Absolutely.
Let me ask you the both of you a question, because we're making an assumption that the person that I'm caring for is local. What happens? I'm sure you've run into this because families contact you. What happens given the mobility of everybody today that I'm not living in Hanover, New Hampshire. I'm living in Boston, or I'm living in Philly, and I get the word or somebody calls me from the apartment next door that this is happening. How difficult it is to maneuver this long distance. It must be very, very difficult.
It is very difficult, and I can speak from personal experience on this particular topic. I had a mother living in another state and could no longer live on her own. She was having trouble with finances and driving, and I met with my brother, who luckily was nearby, and my mother went to live with my brother. There are organizations now that do case management and can help with that, because it's very, very difficult trying to manage, especially when it's a different state and it's a parent or a loved one.
This rise of geriatric care managers, one of them is one of our sponsors in the first segment, Samaritan, but I imagine across the country this rise in the need for geriatric care managers is really, really important, given exactly the scenario that you just painted.
And I think we're going to be seeing a lot more.
Wow. This it's just so fascinating and frightening at the same time. One of the caregiving issues that I keep hearing about and have seen reports on, and I've actually posted some of these reports on the Facebook page of my website, JewishSacredAging.com. Is it true, from your experience, that we're going to run out in the next 20 years of really competent, qualified caregivers to deal with dementia and Alzheimer's?
I think it's going to be very challenging to care for all of the baby boomers that are coming on down the pike.
No, they're here.
They're here. And also with the people living longer with dementia and caring for people with dementia.
Well, and how do we begin as a society? You know, like I said, you're on the front lines. You're dealing with this every day. You see this every day. You see the family dynamics played out every single day. And if what you're telling me is true, and all the reports that I've seen are alerting us to this fact, how do we, as a society, begin to even deal with the fact that there's not going to be enough qualified people to take care of me when I'm 92, God willing?
Richard, I think that the one thing that I would recommend is that we all be patient and understanding. There's such a variety of forms of dementias and the type of assistance that people need. I don't want to set people into a panic, but I also think that people can really support research and funds, because that's one of the ways that we learn about the disease. That's one of the ways that we provide training to staff members and how they can take care of somebody, and also encourage our young people to enter into healthcare fields in different ways to help support this need that's going to continue.
I would imagine also to help to push the idea of urging people and physicians to have some specialties in the area of geriatrics as well.
Correct. This is Lori, and I also think we need to look at, be creative in our resources and look at community-based services, look at adult day programs. As I said earlier, my mother was in Massachusetts. They had a program there that was an overnight program where you could take your loved one, your family member with dementia that tended to wander at night, and at least if they went to the night program, they could have safe wandering and supervised wandering so that the caregiver could get restful sleep, and then be able to provide care and services for that person the next day.
Yeah, I think, Lori, you opened the door to a conversation that will eventually, I want to continue this conversation on this subject, the whole idea of really creative new ways of individuals as our generation ages, how they will choose to live together. I think this is something that's going to happen. I think we're, like you're saying, alluding to it, just beginning to happen now, and people thinking very, very creatively about different forms of living arrangements to be supportive with each other. And I think, look, this is something that we want to explore on a future edition of Boomer Generation Radio. We've been speaking with Lori Flynn, the Director of Nursing at Kendal in Hanover, New Hampshire, and Gretchen Cole, the Administrator of the Assisted Living Program at Kendal in Hanover, New Hampshire, here on the Kendal segment of Boomer Generation Radio. Lori and Gretchen, I want to thank you very, very much for joining us this morning, for really enlightening us and giving us lots to think about and setting the stage for what I hope to be, I know will be a major consideration of a future Boomer Generation Radio. This is too important just to leave to just a little bit. So, Lori, Gretchen, thank you very, very much. I appreciate you being on with us. Have a great day up there in New Hampshire. And to all of you listening, thank you very much for listening. We'll see you same time next week on Boomer Generation Radio, WWDB AM 860 in the Delaware Valley. Have a great day.
Thank you, Richard.
Bye-bye, ladies. Thank you.
Bye-bye.